Good afternoon to all of you, and thank you very much for coming to this press conference. I'd like, before I invite the minister to address you, I would say that we have 10 minutes for questions after he makes his presentation. The Honourable Duane Sands, Minister of Health.
Thank you, Dr. Dalregis. Good afternoon. Today, I would like to provide you with our latest update on COVID-19 in the Bahamas. As of Thursday, the 26th of March, the Ministry of Health has confirmed 9 cases of the virus in the Bahamas. The first 4 previously announced cases are in New Providence. The 5th case is in Grand Bahama and had no significant travel history. The most recently confirmed 4 cases are in New Providence. Only one had recent travel history, and that case had traveled to the Dominican Republic on the 13th of March. All of the most recently confirmed 4 cases are in home isolation, and they are being closely monitored by healthcare professionals. They do not require hospitalization at this time. The first case has been discharged from hospital, and health officials continue to follow the condition of the 3 other COVID-19 positive cases in New Providence and the single case in Grand Bahama, who all remain in isolation at home and do not require hospitalization at this time. They are in stable condition. Contact tracing is aggressively underway by the Ministry of Health Surveillance Unit in New Providence and Grand Bahama. The surveillance unit has already contacted the large majority of those who were in contact with the initial case. The Ministry of Health Surveillance Unit will use an advanced approach to increase the number of contacts reached in the shortest possible time. We continue to closely monitor patients in their home quarantine environment. Contact tracing teams will be strengthened to support daily or twice daily temperature monitoring and change in medical status that might require additional assessment by a senior physician. We would like to thank our volunteer senior physicians for their service during this very critical time. At this time, 175 people have been tested in the Bahamas for COVID-19, following agreed international protocols. To date, we have some 2,300 testing kits on the island. More than 60 ventilators are here, and more are on the way to increase our current capacity. Thousands of PPE kits have been ordered to boost the supplies that we already have in stock. 3,000 additional are expected on the ground on Monday, and a further 4,000 will be here by the end of next week. COVID-19 remains a very serious threat. Around the world, more than 23,000 people have died from this virus. It is very important to address you today about prevention. And it's important that you listen to and follow this advice. Ignoring this advice could lead to you contracting the virus, getting sick, and possibly dying. Ignoring this advice could lead to the spread of it to your family and friends, and they could get sick and die. Ignoring this advice could put doctors, nurses, and other health care providers and workers at risk. And these people are especially needed to care for the sick. There is currently no vaccine for COVID-19. So the best way to prevent illness is to avoid being exposed to the virus. COVID-19 is primarily spread between people who are in close contact with each other through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the eyes, mouth, or nose of others. They can also land on nearby surfaces. When you touch these surfaces and put your hands in your eyes, mouth, or nose, you can infect yourself. So hand hygiene is crucial to success in the fight against coronavirus. We urge you to wash your hands frequently and thoroughly. Washing your hands with soap and water or using alcohol-based sanitizer kills viruses that may be on your hands. I am sure that you know that the coronavirus seems to have an oily coating on its surface. And I'm sure that you know that soap and alcohol are very effective in dissolving this greasy liquid coating. The actual scrubbing physically inactivates the virus, so it can't attach to and enter human cells. The water and scrubbing with your hands create more soap bubbles, which disrupt the chemical bonds that allow the virus to stick to surfaces. So you want to scrub, build up bubbles, and scrub some more, getting into every crack and crevice of your hands and fingers, including under your fingernails, for at least 20 seconds. Cold water works best, but warm water with soap works even better. Cold water works well, but warm water with soap works even better because it makes a better lather and more bubbles. Alcohol-based hand sanitizers are effective too if they are used properly. They need to have at least 60% alcohol in them, and you must use enough all over the surface of your hands. Rub it all over your hands and between your fingers until it dries completely. Alcohol also helps break up the membrane of the virus and kills it, but you need to make sure it gets into direct contact with the virus. While hand hygiene is critical, it is equally critical that you avoid touching your face, especially your eyes, nose, and mouth. Once contaminated, your hands can transfer the virus into your body through contact with the eyes, nose, or mouth. Additionally, make sure you and the people around you practice good respiratory hygiene at all times. This means covering your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Then, dispose of the used tissue immediately and wash your hands. If you have mild cold or flu-like symptoms, stay at home. We do not want medical health care facilities filled with people who do not need urgent treatment. Call your medical health professional or our COVID-19 hotline if you need advice. You can call the 24-hour hotline at 502-7382 or 376-9350 from 8 a.m. to 8 p.m. and 376-9387 from 8 p.m. to 8 a.m. and toll-free 242-300-2619. The call center is reserved for COVID-19 related questions only. If your symptoms escalate and you think you need medical care, please call ahead first. If you have a medical emergency, call 911. A major part of our prevention strategy is physical distancing. By limiting the number of people you are in contact with, you lessen the chance of being infected, and we reduce the spread of the virus. We strongly advise you to stay at home as much as possible. I repeat, stay at home as much as possible. Do not invite people over. Do not have house parties. Do not go wandering around socializing. The more you move around and the longer you move around, you are going to feed the spread of this virus. I cannot overstate this enough. Please stay at home. The purpose of the emergency powers order is to prevent the spread of the virus. When you have to go out for essential items such as food and water, or if you are an essential worker, in as much as you can, please maintain a physical separation of at least 3 to 6 feet between you and others. To businesses that have been allowed to stay open through this order, you must ensure that there's physical distancing. Only allow a limited number of people in the establishment at one time. Make sure that they are kept at least 3 to 6 feet apart. And if there's a line to check out at the cashier or a line to enter, mark out the appropriate physical distance that people should stand at while waiting, and ensure that the patrons follow the rules. We have allowed exemptions to certain essential services and businesses to allow the society to still function in the midst of this crisis. But we need all Bahamians and residents to follow this prevention advice. Our success as a people in this fight against this virus will be determined by how well we follow health guidance and the emergency powers order. If we do, we will reduce the impact. Fewer cases spread out over more time allows the healthcare system to care for the sick. If we do not listen, the virus will spread and more people will get sick and some may die. Our healthcare system would be overwhelmed, just as we are seeing currently in many rich and developed countries. When healthcare systems are overcome by a surge of critically ill COVID-19 patients, many deaths occur. I know physical distancing can be difficult. Humans are social creatures who need group interaction as part of their daily life. We are all comforted by our routines and seeing our friends, families, and colleagues. The emergency powers order was instituted to protect us all. During this period of physical distancing, it is important that we stay engaged with each other while remaining apart to prevent the spread of the virus. So call your family and friends who you can't be with right now. Send them regular texts. Have video chats. I want you to especially stay in touch regularly with the elderly and disabled relatives and friends. At home, be engaged as a family. Go outside on your property, play games together, watch movies or TV shows together, help your children with their homework, read together, work on home cleanup or reorganization projects together. Staying active and engaged and in contact with your loved ones will improve your mental health. In these challenging times, I want you to be as optimistic and as hopeful as I am. With every Bahamian and resident of the Commonwealth doing his or her part to limit contact with others and to follow public health guidance, we can and we will win this fight against this virus. Focus on doing your part to keep you and your family healthy. Encourage your friends and family to do the same. Let us all remember that there are courageous and dedicated healthcare workers and other essential services workers across the Bahamas who are on the front line day and night, fighting to keep Bahamians safe and to provide the services necessary for this country to function. They are providing us with health care, food and water, electricity, telecommunications, security, other government services, news and information. I say thank you to you all. Your services keep us protected, healthy, connected, and informed. You know, Bahamians are resilient people. We have endured through hurricanes and other illnesses. Each time we have faced adversity in our history, we have persevered. We have overcome. I assure you, we will win this fight against this virus together. And as I end, I implore you, please stay at home. Thank you.
Thank you very much. The reporters, as you see, our challenges are many. And so, Madam,
Good afternoon, Rachel Knowles from the Nassau
and can
Guardian.
we permit you one question, please? So that everyone will have an opportunity to ask a question.
How are the cases related to each other, and are the cases related to each other or any previously diagnosed cases of COVID-19? Are the cases related to any previous
Are the new cases? They're
cases
not
or
related to the
each other?
first case, is that you're asking?
Yeah, or are they
They're
related
not.
to each other?
No, we have not, except two of the cases. They're related in friendship and companionship. But the new cases, the three, so there are five. The one in Grand Bahama is not related to the index case. The four new cases, two of the cases are very, very close friends.
Okay, but none of the 4 cases are related to previous.
No.
Okay.
Thank you for your question.
Good afternoon, Jerome Sawyer from RTV. My question has to do with the Grand Bahama case, specifically the contact tracing, which has ensued since that case. Can you provide us with an update on how that's going? And I want to be responsible in how I ask this question, but I'd like for you to be able to respond to reports that a particular establishment may be mass testing or looking at investigating, not mass testing, pardon me, investigating people within that establishment based on that initial Grand Bahama case. I do want to be as responsible as possible
And I appreciate
in asking that question.
And that is certainly your mantra to have been responsible. The case in Grand Bahama is the 24 hours now we've made contacts with most of the cases, but we wouldn't know whether we would give you a percentage within probably 48 hours whether there were 40 plus contacts, and of the 45, how many were contacted at a particular time. It moves. So at this time, we don't have a full count, but we are told that the majority of the contacts identified have been identified. We recognize that there is an establishment that you referred to that's very concerned and anxious about the exposure, and the contact tracing group is aware of it. And as the minister shared with you, we have had to revise, improve, and advance our contact tracing, given now that you have 4 with multiple contacts. The range in number of contacts has been 50, but the spread, 80 to as few as 6. We remove the outliers, so we know, we could anticipate that at least on an average, if you have 4 cases, the minimum would be 200 contacts. So given the capacity issues, we have included in the contact tracing temperature monitoring. And we've also included in the contact tracing referrals to a very senior medical team who would monitor the health condition of the contacts. Before, we would have liked to have gone out and visited the contacts. We're not doing that at this time. As best as we can, we're trying to appreciate the fact that distance monitoring has proven, based on what we've received and what the literature has shared with us, that it's effective. So that is going on with the contacts, but the list is not, we know it's not complete because it takes time. And they remember, well, I've been, such and such.
If you can clarify, you said you're not going out to them, but are they being contacted?
Yeah, they're going out to establishments, but before the surveillance team would visit every contact and every facility that they worked in. but one recognizes that one has to, the distance is the issue, the physical distancing, as well as the capacity. And then we are assessing the effectiveness of the temperature monitoring and the health monitoring. Should they have a problem, we can react very quickly, and we also can reach more people in a shorter time with this approach. So we're modified. Could you introduce yourself?
Sure, no problem. Kyle Walking from Our News, the National Guardian. This question is for Dr. Duane Sands, if you don't
So
mind.
there are two of you from our news.
He's from our TV, I'm from the news. This is for Dr. Sands.
Okay.
Thank you.
I don't know whether you're all ganging up on me.
Dr. Sands, there's a church in Marsh Harbor, Abaco, with dozens of people staying inside and outside in neighboring tents. They've been left displaced since Hurricane Dorian. I just wanted to know, they have no electricity, nothing of the sort. There are concerns about what could happen if one person there contracts the virus and the possibility of a spread in that environment. Has anyone from the ministry been able to reach out to those people, or how's that been handled?
I don't know, Minister, in terms of the discussions on that group of individuals and the reporting functions.
The emergency orders apply across the length and breadth of the Commonwealth of the Bahamas. Social distancing requirements apply just as well in Abaco as they do in New Providence. We understand that there are some exigencies that have led to circumstances, but as best as possible, everybody needs to adopt the recommended policy of social distancing. Inasmuch as these communities are identified, I think we are going to need to get the message out. If it is required that that messaging is in a different language, say in Creole or otherwise, then we will seek to do the same. I think we can all point to examples where persons still have not gotten the message. We see long lines still. We see people converging with each other at doors to get into stores and so on and so forth. I think today's press briefing reminds us that we're not there yet, and we have to redouble our efforts. So speak to everyone to remind them that we are all in this together.
All right, Dr. Sands, while you're there, I just have to ask you.
Well, we really have.
I know, just one more question for Dr. Sands.
Go ahead.
The Attorney General earlier this week mentioned that healthcare providers recommended an extension of the curfew. As the Minister of Health, do you think we need an extension, and if so, how long?
We have made a determination that we are going to monitor this situation very, very closely. At this point in time, we will advise Cabinet colleagues, the Prime Minister, and all stakeholders how we believe the impact of the initiatives, the interventions have been. So I think it's premature at this point for us to telegraph the position of the Ministry of Health and the health team. Every single day, we will advise those in authority as to what our realistic thoughts are about how this whole thing is going. Stay tuned. Tomorrow we'll give you an update. The day after we'll give you an update.
Thank you.
Thank you very much. Happy to accommodate your question, and I'm sure your colleagues would recognize that if we don't take their questions, it's because you asked two questions.
Hi, Janelle Longley, Eyewitness News. This question is for Dr. Sands or Dr. McMillan. These 9 cases, they're all home and self-isolation, so is there a time period that you guys will allow to pass before testing again to ensure that they've recovered and no longer carrying the virus?
Okay, so certainly when we put persons in quarantine, we generally recommend that there is testing prior to releasing them from quarantine. Isolation should follow a similar protocol.
No, I'm talking about testing again to see if they still have the COVID-19, to see if
Right.
they're recovered. Yeah.
Right, so certainly the 14 days incubation period will apply to the quarantine persons, those who we are observing to see whether or not they develop symptoms. That's the 14 days and then testing. That is the recommended protocol. As it relates to those in isolation who are symptomatic, those persons we will monitor. Some persons, depending on their illness, you know, how it progresses, it may be more than the 14 days. So the recommendation is for testing prior to persons coming back into the general public. But what we have to realize also is, you know, the capacity to do that kind of testing. So we have to manage that, and certainly we have to monitor where the persons in isolation, how they're doing. We spoke about, you know, monitoring the temperature, how well they're doing, and should we actually move in the direction of allowing them to come back into the society, testing is recommended. Yeah, but that, I think that's what I was alluding to.
Okay.
Those in
One is Duane,
isolation.
yeah,
Okay.
who are positive.
Right.
And it is, okay. Madam?
Hi, yes, good afternoon. Sloan Smith, Eyewitness News. So based on the confirmed cases thus far, we can see that there have been different clusters of the cases. What does this now mean for the community spread and how we are seeing its growth in the Bahamas?
It's an excellent question, because given the time and not only where they're located, how many contacts they have already, but we also look at when their symptoms started. So we now can establish that we have community transmission based on the preliminary findings that based on the cases, the contacts and where the contacts are, and the length of time or the onset of the symptoms, we have determined that it's community spread.
And does that raise any alarms right now? I mean, well, alarms were already raised, but does this now mean that we are needing to head into overdrive?
We have been in the preparatory phase in the last, I would say, 3 or 4 days for a surge. We are now in the surge as far as our population. You cannot ask any more questions, I'm sorry. As our population responds and the tests are becoming positive. So we're monitoring the clinical presentations. We have an active hotline. We're looking at the contact tracing. We're monitoring the contacts. We now have to plot the areas where the cases are occurring to address the cluster. And I like your introduction of that, because we do have to GIS map our contacts and our cases so that we can look at interventions or modalities of moving forward or where to anticipate cases. Madam?
Good afternoon, Jimenita Swain from ZNS. My question, I know that you indicated that the first patient has already been released from hospital. Are there any concerns with persons having or feeling a sense of a stigma? I know that we had protests in Grand Bahama over the clinic being used, or that facility being used in West End, but I know that persons have voiced their concerns over the patients and if they will get reinfected, things like that. Is there a stigma concern that you will be addressing at some point?
Yes, that's the fear factor, Minister. You're good at that, please.
We would have addressed this issue. I want to remind everyone in this country that those persons who have been unfortunate enough to be stricken with COVID-19 infection could be your mother, your father, your grandmother, or your child. And while fear is certainly the order of the day, education and empathy. One of the purposes of these sessions is to educate and to inform. And so when people protest, when they raise concern, we should embrace them with an appropriate social distancing and seek to explain what's going on. because it is typically because they don't understand. This virus does not jump through walls. It does not come out of the sky. It is as a consequence of social interaction. And I think that message needs to be very, very clear.
It is understood why something that is as infectious as this virus, it is also understandable that the information is coming, is changing. It is also understandable that our neighbors in our television, we see the morbidity and the mortality. It is worrying. So we're asking you to help with the educational aspect. If you do this, you minimize, you decrease. You don't remove the risk, but you minimize the risk of being infected with COVID. You tell folks that only a few, what you see on the TV is mainly the 20% of those who have the infection. It's not 100%. We have to give that reassurance, but it is understood why they would be concerned because of the properties of this viral infection. And we're really leaning on all of us and our leaders to be hopeful and optimistic that we do not have the designation of a COVID country.
Good afternoon, Leandro from the Tribune. Now, you mentioned that we already...
So you have two from the Tribune?
No, only me.
Okay.
Yes, you mentioned that you're already seeing a surge of cases in the country, and Dr. Sands has already said that our healthcare system is already challenged. How much cases could it be that would put a further strain on our healthcare system, provided that they are not in self-isolation?
Predictive value.
We have taken the approach that we would like to minimize any growth in the number of cases in the Commonwealth of the Bahamas. So any case is one case too many. And so we are not going to inquest, we are not going to capitulate, we're not going to give in. We are going to work every single case and all of their contacts every single day, so that at the end of this, whatever the number is, it is minimized. And so we say that any case is too much. Are we prepared? Yes, we are. Do we have the staff? Yes, we do. Do we have the personal protective equipment? Yes, we do. Do we have the resolve to beat this? Yes, we do. But if we take the position that we are not keenly interested in any additional cases, even though we know and expect that there will be, that is the attitude that is going to get us to beat this thing. And I want every single Bahamian to join in that battle.
I want to thank you for that question. We also have, as Minister Sands says, a team lead that looks at acute care, the facilities, the infectious disease persons. We've truly come together. We have 3 ID persons. We have hospital administrators. We have a team that looks at the response and would give guidance to the Emergency Operations Center. And there were triggers as to when we need to do something differently. So we're monitoring the situation, but I think it's a good question.
Good afternoon, Laurentia Smith for Jones Communication.
Jones, sir.
Yes, ma'am. My question is for Dr. McMillan or Dr. Sands. Now, we know around the world there are reports that medical professionals are overwhelmed with the virus and what's going on. My question is to you or Dr. Sands, what is the ministry doing to ensure that the medical professionals do not feel overwhelmed, because we really don't know the state of this virus?
Okay.
So early on, we started working with our healthcare professionals to ensure that they would have, they would be really up to date regarding protocols, what is happening as it relates to their expectations for interactions with patients in a safe way. We continue to do that. And certainly we have a system where we support healthcare providers through on a regular basis their activities as it relates to patient care. I would give you an example in the primary care services, which I'm most familiar with. We have the executive management team, and certainly the physician who heads that and the nurse who heads that, as well as the administrative head. We would have started having conversations and providing protocols and, fielding concerns and queries, and we are doing that on an ongoing basis so that we would be in a position to augment, provide additional assistance or guidance as needed. So, using that model, which I believe happens across the health system, we believe that we will be well aware if we are getting it to a place where our healthcare providers are becoming overwhelmed, or if for whatever reason we are having, excessive sickness, or, if we're having outages in a particular category. So we're using a model that we always use, but I think we have enhanced our connectivity with the providers.
Ladies and gentlemen, that was the last question, but it really stimulated a response concerning how do we monitor the health and well-being of our healthcare providers, given that what we're seeing now is the really impact of this. We're monitoring. I want to give assurance that we're doing active monitoring of the health condition of our healthcare providers. We also hope to accommodate respite times. We also hope with our healthcare providers to prevent contamination or increasing the risk to their families as they go back and forth. And so we provide options for the healthcare workforce to work in this very challenging and difficult environment. I want to thank you all for coming and appeal to you that what you do is not only for yourselves, for your families, but also for your country. That concludes our press conference.